I'd like to welcome everyone to the third session of our 2022 fall webinar series. Before we begin, just a few housekeeping notes. If you have questions during the presentation, you may type them in the chat box or the question box on the bottom right-hand side of the control panel. We will answer them following the presentation. The webinar is scheduled to take approximately 1 hour today, and a link to the recorded webinar will be sent out to all registered participants and will be posted to our website, saskatchewan.ca/agriculture, within about 24 hours following the live presentation. At the end of this session, you will be prompted to complete a short survey. Your feedback is important for planning future events, so please consider filling it out. I will now turn the webinar over to your facilitator for this session.
Hi everyone, and welcome to day 3 of the 2022 fall webinar series. My name is Dale Weinbender. I'm a livestock and feed extension specialist with the Saskatchewan Ministry of Agriculture, based at the Tisdale office. I will be facilitating today's webinar on vaccination. Our presenter for this webinar is Dr. Joyce Van Donkersgoed. Dr. Van Donkersgoed was raised on a mixed beef and cattle farm east of Coaldale, Alberta. She graduated from the Western College of Veterinary Medicine in 1985, practiced in the beef practice for 2 years before returning to WCBM to complete a clinical residency and a master's degree in advanced bovine medicine and epidemiology. She worked as an associate professor in the Department of Herd Medicine and at Vito as a beef cattle specialist for 6 years before returning to Alberta to work on a contract as provincial beef veterinarian. For AAFRD, working with the CCA to build a quality starts here and verified beef production programs, while conducting applied research in beef quality and food safety. After doing this for a decade, she worked with ACFA as their environmental coordinator for 5 years, helping build Alberta's environmental farm plan program and the feedlot environmental best practice manual. She then returned home to Southern Alberta and set up a feedlot consulting practice in Big Tribute, providing herd health, regulatory emergency, and research services to her large feedlot clients, as well as a one integrated sheep operation. After 16 years, she retired from her active practice 2 years ago, and since then has set up a consulting practice to continue helping the beef industry on developing educational materials for beef producers and vets, as well as conducting applied research for Vito, AAFC, and universities. She's a past president of the WCAPV, recipient of its Bovine Practitioner Award, and recipient of its CVMA Bovine Welfare Award for her development of the NCFA's PAACO Feedlot Welfare Audit Program. She works in a retainer for the NCFA and ACFA, providing technical advice and managing their animal care and national feedlots, their AMU and AMR surveillance programs. At this time, I'd like to turn the webinar over to our presenter. Go ahead, Joyce.
Thanks very much. Can you hear me okay?
Yeah, you're good.
Okay, good. Great. Well, it's nice to be here. I've been asked to talk about vaccination programs and proper use of vaccines in beef cow herds in Western Canada. And this is part of a project that a large group, I'll show you at the end, are working together on to develop some educational materials for producers that is funded by the Beef Cattle Research Council, as well as many others, which I'll discuss at the end. So it's important to note that vaccination is only one aspect of disease control. There is no such thing as a silver bullet to reduce infectious disease. Usually we talk about a triangle, of the animal, its immunity versus environmental exposure. And so we always have to look at really important things like management, good nutrition. If we don't have good nutrition, particularly we have to watch this in drought years, then our animals may not respond to vaccination like they should. And then obviously good husbandry practices. If we're calving in a corral and it's very overcrowded and it's very muddy, we can overwhelm vaccine immunity very easily. So it's a very important combination between, building the immune response, then having good response to vaccination, and then managing the environment. So disease prevention strategies should be actually customized for each beef operation. It's always a bit concerning, you know, if we make standard protocols, vaccination protocols for every operation, because every beef operation is different. You know, what the producer's needs are, what his disease risks that he's willing to take do vary amongst producers. So we need to take that into account when we're building vaccination programs. So vaccination, you know, like I said, it's not a silver bullet, but if done properly, it should minimize disease risks to the particular vaccines that you're using. But obviously for vaccines to work, we have to administer them properly. So we will talk today about proper administration of vaccines, because the simplest little thing can affect the effectiveness of a vaccine, and then you've just wasted a lot of money, and your cows then or heifers are at increased risk of disease. Vaccines don't result in immediate protection against disease. Most vaccines that we give need at least 2 weeks to generate a protective immune response. With kill vaccines, we actually need to give them twice initially to generate an immune response. With some of our intranasal vaccines that we have now on the market, like Enforce and Nasalgin, you know, we can get a slightly earlier immune response to them within 5 to 7 days. But normally we want to vaccinate prior to the disease risk period to ensure the animal is protected before exposure. It's also important, like I said, that with certain vaccines, you know, it's important to read the manufacturer's label directions, because they will tell you whether you need to give 1 dose and it's good, you know, for a year, or you need to give 2 doses so many weeks apart before you get a good immune response. So it is important to try to follow those manufacturer's directions, and they do vary from each product that we have. Not all animals, even if we did everything perfectly, will respond the same to each vaccine. What we're generally trying to do is, we know that not every animal will respond the same. Some may not have a very good immune response to the vaccine, but we hope that if we can generate herd immunity, have at least 80% of the animals in the herd with a good immune response to the vaccine, that we will prevent infectious disease problems. The other thing to remember is there is no such thing, I wish there was, that you could vaccinate once and it would last the life of the animal. Vaccines, generally, most of the ones we currently have on the market, require at least a minimum of a revaccination or a booster shot every year. And that sometimes is something we forget because we get busy. So your vaccination program should include information on the frequency of boosters to maintain that immunity. The other thing to note is that not every vaccine on the market is needed in your herd. So just because there's a vaccine in the market doesn't mean you need it. You know, what disease risks do you have in your operation? What disease risks are you willing to live with without vaccination? And the other thing we've learned over time is that we don't want to give too many different vaccines at the same time, because we overwhelm the animal's immune response and they don't respond as well to all those individual vaccines or antigens or viruses or bacteria within the vaccine. We call that antigen overload. And so we have to be particular about which particular vaccines or viruses or bacteria that we're going to vaccinate against are needed in our herd. The other thing to note is your veterinarian should talk to you about is not all vaccines are created equally. So you could have, you know, 3 different vaccines with the same viruses and bacteria in them, but they're not all the same. And so it's important to know which ones are maybe better versus not as good, or which ones actually the latest research doesn't say that they're worth your money. So when we are vaccinating in a cow herd, it's important to try to vaccinate different groups, age groups at the same time. Probably the one exception would be, for example, if we're using an E. coli scour vaccine, we're going to vaccinate, you know, our heifers or our pregnant cows before calving. If you're using that vaccine, then, you know, sometimes if you have a very large calving interval, you can actually have reduced colostral immunity that goes to the calf if you vaccinate the entire group at once. Sometimes there, depending on your ability to manage those cattle and revaccinate them or vaccinate them, we want to time it closer to their pre-calving interval when they're going to calve to have the best colostral immunity. But otherwise, you know, typically with spring processing, we're going to vaccinate all the calves at once, for example, clostridials, knowing well we might have some calves that are 3 weeks old and some that are 2 to 3 months old. Those are just some of the practical realities we deal with. Where I've seen herd outbreak and problems is when we buy in new replacements, or we buy some new cows, bred cows in, or even if we're bringing in a bull, if that animal is either not previously vaccinated and they get mixed in our own cow herd, if our cows are shedding a certain virus or bacteria, then that newly purchased animal might actually get it disease because we haven't vaccinated against that particular virus or bacteria. But more often what we see is when we bring new stock in, if we haven't kept our vaccinations up to date with our cow herd, is that that new animal actually brings in a virus or bacteria, and then we have a problem such as an abortion outbreak. So it's important to try to find out when you're purchasing new stock, what have they been previously vaccinated with, and when were they vaccinated with that? And if you can't get that information when you purchase these animals, then we do recommend, if they're pregnant already, that for safety's sake you use a kill vaccine. Keep them quarantined from your new stock for at least 2 weeks so they can build an immune response to the vaccine prior to exposing them to your existing stock. So what is a vaccination program? Well, most vets will call vaccination protocols. Protocol is a document that tells you how to do something. So in this case, your veterinarian should provide you with a vaccination protocol specific to your herd that is going to advise you on what vaccines to use in which groups of cattle and when to use it, and then how often to booster. So normally most vaccination protocols will be broken down by replacement heifers, your mature cows, your bulls. We got to remember not to forget the bulls. And then pre-weaned, and if you keep your calves post-weaning, also post-wean calves, because they're all at different disease risks, and we would vaccinate maybe with different things in these different groups of cattle because of the different disease risks. So again, veterinarians typically dispense the vaccines to you, but it is incumbent upon them as part of the valid vet-client-patient relationship they're required to have with you before they dispense any products to you, is that they understand your beef operation. They have talked to you to understand what you want and what you think your disease risks are, or hopefully know what your disease risks are. And then together you talk and discuss what's the best vaccination program for your operation. Obviously, if you're doing something like you have a purebred herd and you're exporting cattle to different countries like the EU, which is Europe, you also need to be aware of the requirements for those countries because they may not allow you to use certain vaccinations. For example, in the old days, IBR we had to be careful about because certain countries in Europe don't have IBR, and we can't just use one of our IBR vaccines because then they can't tell natural infection from vaccination. So if you are exporting purebred stock across the ocean, then it's important to know what the requirements are for that country. Okay, and if your vet, has dispensed some vaccines to you and they have not worked with you and developed a vaccination protocol for you and provided you with one, then please ask them to provide you with one, because that is actually their responsibility to do that before dispensing product to you. The thing with vaccination protocols is disease risks change in an operation. Your operation might have changed. You might have changed the type of cattle or number of cattle you have. You might have been a closed herd, but now you're an open herd, which means you bring in different animals at different times, you purchase and sell. And so, your veterinarian needs to review vaccination protocols with you at a minimum at least once a year. The other thing is you may have decided to become part of a branded beef program, or you want to sell your calves as pre-immunized calves. So you may have different requirements or needs that your veterinarian needs to be aware of. And the only way they're aware of that is if you actually communicate together. The other thing is you may have had bad experience with a particular vaccine and you may not want to use it anymore. So it's important you discuss that problem that you had with your veterinarian. Hopefully you did it at the time you were having the problems with the vaccine, or you had a high disease risk and you had vaccinated against that, and you were concerned the vaccine didn't work. So again, important to discuss with your veterinarian at least once a year. If things went well, then maybe you just want to have the same vaccination protocol as previous years. But if some things changed, or as veterinarians, there's new scientific evidence all the time about vaccines and their efficacy, as well as there's new vaccines sometimes on the market. And so then there may be actually a better vaccine for your herd based on your herd needs. This is an example of kind of a very basic vaccination protocol. Here we just have, the name of the ranch. We have broken it down by the type of animals that we have, from calves, replacement heifers, cows, and bulls. Then here we're talking about the time of when to give the vaccine. And then we're talking here about which vaccine. I just labeled them A, B, but you would have names. For example, you might have Enforce here. You may have a different vaccine here. And your veterinarian should have the dose of the vaccine, what route of administration. So IM is in the nose, and then the withdrawal period. Vaccines do have a meat withdrawal period, so that is important. Obviously not in young calves because we're not sending them to slaughter. But if you have maturing animals like your heifers, cows, or bulls, then you need to be aware of the withdrawal periods. They're not all 21 days. We do have some vaccines with 60-day meat withdrawal periods. And obviously, you need to follow those prior to sending those cattle to slaughter so you don't have a violative drug, or in this case, vaccine residue. And then your veterinarian can also have some additional instructions here, comments for you to provide some advice on the vaccines. And then they should have their name on it because it is a protocol, as well as their clinic name and contact information and the date. And if you're part of various programs like Verified Beef Production Plus or independently through the Canadian Roundtable Sustainable Beef, the auditors that come audit your operation will want to see these kind of protocols. Excuse me. So what are core vaccines? Part of this project that I'm working on with the Beef Cattle Research Council is to identify what are basic vaccines based on diseases that are just commonplace that cow-calf producers should use in Western Canadian beef herds. So those are what our core vaccines are. The infectious agents are endemic, which means common to the area. There's a potential public health risk with most diseases we're dealing with cattle, other than those bugs in manure, the ones we vaccinate typically against. They're not a human disease risk other than anthrax or salmonella, which is pretty rare. Required by law, we do not have any vaccines required by law. Are virulent or highly infectious? Well, most of the viruses and bacteria we deal with are both infectious and virulent, or pose a significant disease risk. And so the AVMA is the American Vet Medical Association. They came out with vaccination recommendations for veterinarians in North America of what they considered core vaccines. Our working group, which contained a lot of experts from Western Canada, we discussed this at length, and we came to an agreement that we also would recommend these as core vaccines for all Western Canadian beef herds. So the viruses we're recommending that beef herds in Western Canada be vaccinated against are IBR, or infectious bovine rhinotracheitis, or more commonly known as red nose. Then BVD, or bovine viral diarrhea virus. PI3, we don't think that causes much disease, but with most vaccines with IBR, it comes along for the ride. So indirectly, it would be considered a core vaccine. And then VRSV, or bovine respiratory syncytial virus. When it comes to bacteria, the core bacteria to vaccinate against are Clostridials. Our group had a lot of debate whether that should include Clostridia hemolytica or Clostridial tetanus, or tetani for tetanus. And again, those two latter ones, we decided to leave them as risk-based, based on what the US had decided as well. Although depending on what your herd risks are, again, then they become risk-based. So what is a risk-based vaccine? Well, that means not every cow herd needs these particular vaccines, or not all animals within a herd need them. And your veterinarian should work with you to determine what your disease risks are and whether it's worth vaccinating for those particular bacteria or viruses. So your risk will depend on what area or geographical location you are located at in Western Canada, whether you have a closed herd, which means you don't bring in any new cattle, and you just have your cattle within your own herd. There are not too many truly what we call closed herds in Western Canada. An open herd is, where you might bring in bulls, whether you lease them or own them. You may buy replacement heifers or purchase additional cows, or you might bring in feeder calves that you feed some additional to your own calves. So obviously then you're an open herd. And then your disease risk obviously depends on what problems you've had with a disease before, or sometimes it's not problems you've had, but just problems your neighbor has had, which means you're at increased risk for them potentially. And at the end of the day, in the beef business, we're generally in it as a business to make money. And so it's important to look at what is the effectiveness of the vaccine and its cost, and is there a cost-benefit ratio for you to actually use that particular vaccine. So here on the right, this is all the different risk-based vaccines. So Mannheimia hemolytica, Pasteurella mellitus associated with bovine respiratory disease. Histophagus can also be related to bovine respiratory disease, but causes its own disease called histophilosis. If you have a lot of scour issues in calves, then often you will have a combination of rotocoronavirus and E. coli. E. coli particularly in very young calves, 1 to 3 days of age. Some areas of, I know, southern Alberta, leptospirosis is an issue. Pink eye, that's caused by, if you have pink eye in your cattle, Moraxella species can cause that. We do not have currently a good Mycoplasma bovis vaccine on the market. That causes chronic pneumonia, can cause arthritis, as well as ear infections and mastitis. Rabies is generally not a very common problem here in Western Canada. If you are in Eastern Canada, you may consider that. But generally, this is not a problem in beef herds here in Western Canada. Salmonella as well, traditionally is not a common problem here. We have our nice cold winters, although it's sun that usually kills the bacteria. But if you're buying in dairy replacement heifers, which I don't know why you do that in herd, but you might buy a dairy calf to bring in if a heifer lost her calf, then you got to worry a little bit about salmonella because it's a little more common in dairy cattle than beef cattle here in Western Canada. Again, vibriosis is related to abortions. You need to talk to your vet about whether you should include Vibria. Anthrax is a reportable disease. It does occur occasionally. And then if you're in an area where there is a concern of anthrax, because it is reportable, your veterinarian may recommend anthrax vaccination. Foot rot, there is a vaccine on the market. Again, you need to discuss with your veterinarian whether that's high enough risk and whether the vaccine is effective enough to make it cost effective. With mastitis, that's generally not a very common problem in beef herds. This would be more vaccines for dairy herds, but there are mastitis vaccines on the market. And the papillomavirus is your pox. This, causes warts and stuff. Most of us, would not recommend a vaccine for that simply because it's self-limiting disease. So with all these vaccines and different trade products on the market, how do you figure out what vaccines would be good for your herd? Well, that's again why it's important to talk to your veterinarian. Some of the questions you had earlier talked about modified live versus kill vaccines, their benefits, and it says pros and cons to each types of vaccines. Modified live generally will give you a better immune response, but with certain vaccines, you have to be careful if you have pregnant cattle, and then timing of the vaccine. But you can use modified live in bred cattle as well, as long as they've been previously vaccinated with that trade company's similar product. Kill vaccines are a little safer to use, but they don't generate as long an immune response. You do definitely need 2 doses to induce initial immunity, and the immunity doesn't last as long as a modified live. So again, this is where you need to work with your veterinarian, because you may have, we may give you a vaccination protocol based on the best time to give a vaccine, pre-breeding, but you may just not have the ability or facilities or help to actually work your cattle at that time of the year. So then part of the vet's job is to discuss what's the pros and cons of using the different vaccines and the different timing of the vaccines on reducing your disease risks in your cow herd. So as I mentioned earlier, it's always important to read vaccine labels. And I know in the old days, ranchers would tell me, well, Joyce, I can't read the vaccine label because the print is so tiny. Well, now that I'm older, I also can't read the vaccine label because that print is too flippin' tiny. So there is a free app you can download onto your cell phone. So whether you have an iPhone or you have an Android phone, if you go into your Galaxy Store or your Apple Store and you type in CVP or Compendium of Vet Products, you can download this app free of charge. And it has all the labels, drug labels, vaccine labels for cattle and actually all species. That is really, really handy to have in your phone. And then on your phone, you can actually make the screen bigger so you can actually read the vaccine labels. And this is updated all the time, the app, so you will have up-to-date labels on your vaccines as well as any other products you have questions about. So this is a very handy free app to download on your phone. Otherwise, if you don't use a cell phone, then if you have internet connection, you can also access this on your computer, which would have an even bigger screen to read the labels. And then you could also print them if you so choose. So with vaccines, whether they're modified, live, or killed, how well they work depends on many factors. So in the next few slides, we're going to talk about proper vaccine handling. So vaccines, you know, when I was training a lot of my feedlot guys, the big thing I would always say is don't freeze it and don't cook it. So vaccines need to be handled with care. So we want to keep them cool at all times. From the time we pick them up at the vet clinic to the time we take them home and put them in our fridge, as well as the time we transport them out, whether in the backyard, we're going to be vaccinating these calves, or on the ranch somewhere. We need to keep them cool at all times till we use them. And even when we're using them, we have to make sure we don't cook them or we don't freeze them. If vaccines get higher than 7 Celsius, and I usually use 10 because your vaccine fridges or your fridges where you put your vaccines sometimes fluctuate a bit. Definitely when you're getting above 10 Celsius, you need to worry about how effective those vaccines are. And obviously, if you freeze them, you get to 0. Frozen vaccines should never be rethawed and used because they're no good. They need to be thrown out. So as you know, vaccines aren't cheap. So it's important we take care on how we handle these so that we don't freeze them or don't cook them. The other thing to watch, especially when we're working cattle and vaccinating them, is that we keep the vaccines out of direct sunlight. Now I'll show you a picture later on where I was at a spring branding, or I was supposed to call it now spring processing, someone told me, but it was spring branding. And, you know, they used half a bottle of vaccine, left the other half on the back of the truck. And of course, it was sitting in the sunlight. Never mind, it was getting hot, but the sunlight will destroy vaccines, particularly modified live viral vaccines are quite sensitive. So when you go to the vet clinic, if you're going to pick up your vaccines, you know, your vet should provide you ideally with a cooler box with frozen ice packs in there for the vaccines for you to transport. It's important when they're putting the vaccines in that cooler box, and check your vets too, or the techs there, that they don't put bottles directly on the frozen ice packs. So most of your IBR BVD vaccines, they come in a box. So the box can go on ice packs, but your Clostridiols come in bottles. And your, you know, your one-shot or pre-sponsor vaccines also come in bottles. They should not put those directly in frozen ice packs. So there should be some bubble wrap or paper between the vaccines and the frozen ice packs, because that being directly on the ice pack with the bottle, you can actually damage the vaccine so that it's no longer effective. And then when you're hauling it home, you know, it's important not to have these coolers on the back of your pickup truck. Ideally, they should be in the cab with you. And if you're going to town to do other chores, pick up other things, you know, ideally try to make your visit to the vet clinic the last stop, so you don't have those vaccines sitting in a hot truck cab for a long time. And then when you get home, it's really important to take them out of the truck cab and put them in the fridge, because I have had guys where they spent all the time and spent the money, picked up the vaccines, and then their staff, you know, took them out of the truck, and then they just left them in front of the fridge, never actually put them in the fridge. And then producers had to throw out all the vaccine, which is expensive when you have to do that. So here's a picture showing you where, yeah, you got a nice cooler box. Your IBR, BVD vaccines are nice in the little boxes, not on the frozen ice packs here. But these are your Clostridiols, and they're sitting directly on the frozen ice packs. So again, you know, make sure that you have some kind of paper or bubble wrap or something in between so the bottles are not directly on the ice packs. This is often overlooked. The other important thing is not to fill your cooler too full, because if you fill it right to the top, unless you have ice packs also on the top with some insulation between, those vaccine bottles on the top are not going to stay cool enough if you're out there for a few hours. So try not to overload those cooler boxes. So here's a picture of the branding I was at, where they had mixed their IBR BVD vaccine, filled one syringe, and they went off to vaccinate, but this bottle was sitting on the back of the pickup. So it is now being broken down. This is a modified live vaccine, and it's being broken down by sunlight, as well as getting way too warm because it was a nice over 20 Celsius day that day. So again, please, these vaccine bottles, if, you know, once you mix, say 100 mil or 100, yeah, it's a 100 mil bottle with 50 doses. You know, if you're using a 50C syringe, you're only going to use half the bottle. The other half of the bottle should go back in the box, and then the box back in the cooler with the lid on, and so it stays cool before you use it. So these are little things that can make quite a difference, because now those calves that are going to get vaccinated with this leftover bottle, actually will probably not be protected against IBR or BVD. Leftover vaccine. Well, the thing with modified live viral vaccines, these are the bottles that come in a liquid plus a dry component, and you mix them. It's important that, they're only good for 1 to 2 hours after you mix them. And after that, you actually need to dispose of them because the virus has decayed too much and will not be very effective. With your other vaccines, like your Manhema hemolytica, we vaccinate for respiratory disease, comes in trade names like one-shot or pre-spons or Hippobovis somni leukotoxin. If you read the labels on those, once you open them or use them, they're only good for 8 to 10 hours, which means at the end of the day, they need to be thrown out. You can't just stick them back in the fridge, and if you're going to vaccinate the rest of the cattle the next day, the drug company won't stand behind those vaccines. Clostridial vaccines, if you read the labels, also say to use them up in the same day. Different veterinarians will say, well, if you kept the bottle, clean and didn't contaminate it, put it back in the fridge, it's probably good for a few days. But again, if you have an issue with clostridial disease after you vaccinate, the pharmaceutical company's not going to stand behind it because they did not follow the label directions. So one way to reduce the number of doses of vaccine you end up throwing out is to try to buy vaccine bottles of different dosage sizes. So most of our vaccines, will come in 50 doses. Clostridials can come in a lot bigger doses, up to 250 doses or 500 doses. But then try to buy some smaller vials. With most vaccines, other than straight IBR vaccine virals, you should be able to get a 10 dose as well. And then when you're going out to vaccinate, as you're getting fewer cattle left to vaccinate, then try to go to the 10 dose vials. I know they're a pain in the butt to mix them and fill a syringe because you have to use a lot of them, but it is a little bit cheaper than throwing out, where you've only used 3 doses out of 50 dose IBR BVD vaccine, and you got to throw all the other doses away. That gets pretty expensive. So modified live viral vaccines, they are the best vaccine for a good immune response that lasts the longest. They definitely have to be handled with care. So you only want to mix 1 bottle of the modified live at a time. Use it all up before you mix another bottle. And like we said earlier, these bottles are only, once you mix it up, that vaccine is only good for about 1 to 2 hours. So this is Bill Newton here, a rancher. He's got his transfer needle in the bottle with the liquid, and then he's going to stick it in the bottle with the dried component and have it reconstituted. So on the next slide here, you'll see the vet student is also doing that. She's got a clean transfer needle. It's important to only put clean needles in your bottles, because otherwise you contaminate that vial, and then you may have issues where the vaccine doesn't work as anticipated. And if you should have, actually, you always have to put the needle first in the dry component before you put it in the liquid. And you should have then negative pressure here in the bottle with the dried vaccine component, and it should pull that liquid in. If it doesn't, and you've done it properly, that actually could be some concern. I'd probably call your vet, because they should have that vacuum still in. I would check your expiry date on your vaccine to make sure it's not expired, because you do not want to use expired vaccine, because most likely it's not going to work very well. And as you see, she's trying to reconstitute it with gentle swirling of her wrist there. Sometimes though, there might be a little bit of that liquid left in the vial. And then usually what I'll do is get just a clean syringe with a needle and draw out the last bit of that liquid and then put it into the vial with the powder cake. Sometimes there's a lot of pressure when you try to do that. And sometimes you'll just have to put the needle in and let some of that air, or get another syringe, pull some of that air pressure out so you can get that fluid in there. It gets too pressurized. And you want to put the entire dose of the diluent in there, or else you're not going to have the number of doses in that vial that you want to give. So in this video here, they're gently swirling the vaccine. We need to dissolve that powder cake in the liquid. You do not want to shake this very hard, because you actually can damage the antigens in the vaccine by really hard shaking. And it should dissolve within a minute or 2. Sometimes if it doesn't dissolve right away, it might be your vaccine bottles are too cold. So sometimes if you just let them sit at room temperature for a minute or 2 and then try to reconstitute them again, just swirl them some more, the powder cake should dissolve. If you're having trouble where the powder cake just will not dissolve after a few minutes, again, you may want to call your vet and say, hey, I'm having trouble with this, because sometimes we do have problems with some of the vaccine that we receive. And then we need to talk to the pharmaceutical company about that and get replacement on the vaccine. Obviously, that doesn't help you when you're out in the back 40 and you've got cattle to vaccinate, and that's the only vaccine you have. So hopefully it will dissolve for you. Clostridial vaccines, they come in, often big bottles like this. They're already pre-mixed. So this is like your Tasvac, Covaxin, Vision, Firmicon, Ultrabac. You can either, if you're out in the ranch here, you're going to do spring processing, you can hang them over your shoulder, or here at the chute, you can hang them with little straps at the chute and have your syringe here with a draw-off syringe. The important thing is these have a lot of granular material within them. So you should mix those bottles before you use. And then with gravity, whether you're hanging it on your shoulder here or on the chute, that material will settle in the bottom of the bottle. So every once in a while, you want to just grab that bottle and remix it again, because we need it properly mixed so the calves or older cattle are getting the proper amount of constituents within that vaccine. So just mix it every once in a while you're working with it. Well, it's very important we only do our injections in the neck area of cattle, not under the armpits. Even if you have roped them and you're hanging on with that front leg, that's an easy location to vaccinate, but it's a bad location to vaccinate. We have a lot of nerve plexus or nerves under here, that armpit. If you get an infection, that is a very bad place to have an abscess. So we want to vaccinate in the neck of cattle. You don't want to hit the shoulder because you will break off the point of the needle and cause a lot of damage and make that animal lame, and it may not recover very well from that. You don't want to vaccinate the big ligament in the neck or on the spine here, because you can create a spinal abscess, and that animal over time might actually go down on you because of that abscess as it grows on, pushes pressure on the spine. We don't want to vaccinate in the vein or the carotid artery here. There's a jugular vein or carotid artery, because you'll actually probably have an anaphylactic reaction or allergic reaction. The animal might die on you. So in this triangular area is the area in the neck where we want to vaccinate. You don't want to vaccinate in the back end of cattle, because that's where we sell our steaks and our expensive roasts, and we create scar tissue that persists the life of the animal. So we should never vaccinate in the back end of cattle. The other reason to vaccinate in the neck is we have some big lymph nodes called prescapular lymph nodes here. So we tend to get a better immune response if we vaccinate in the neck. Obviously, with intranasal vaccines, those go up the nose. It's important when we're going to vaccinate, we properly restrain our cattle so they actually get the vaccine in the right location to get the full dose of the vaccine, so it's going to work. If we have cattle bouncing around in the alleyway or in the chute, we're going to potentially break off needles and have a physical food safety hazard. Half that vaccine might squirt on the outside of the animal, doesn't work on the outside of the animal. We also can get a lot more bruising and muscle damage that creates scars and tough meat when we send those animals later to slaughter. And we can also have the vaccine leaking out of the injection site. And again, it doesn't do any good on the outside of the neck. So the other issue is people can get poked with these needles. The Clostridial vaccines are not so nice to poke yourself with those. Or sometimes it's just the dirty needle. You can get an infection from that yourself, which we don't like to have. So here, on the ranch, we might have for calves a calf table, which you may or may not flip. And more common on our spring processing, we're going to rope the calves. A lot of people now like that North Fork calf catcher to hold that neck. And so, but you can do it the other way, just with, you have someone on the front end and they have a knee on the neck and then pull that front leg up to restrain the animal. So, but it's important that we try to restrain it properly so we can get the total dose of the vaccine properly. If we're using a squeeze, especially for bigger cattle, it's important that we use the squeeze chute to slow that animal down, because we don't want to first break a neck and have a dead animal or cause a lot of bruising in the neck area there. And then ideally with vaccines, if you have the bars on the chute, you should vaccinate between the head bars there. Some of the ranch chutes have a bigger area here behind the head gate where you can vaccinate there. But again, really important not to hit the shoulder when you're vaccinating behind the head gate. Vaccinating in an alley, sometimes if we don't have good facilities, that's what we're left with. This is definitely not the best way to vaccinate cattle. As you know, with calves, they're going to jump over top the one ahead or go underneath it and lift the other one up. It's much bigger risk for human safety issues, especially when you're putting your hands there. And the other thing is, it's really hard to give a good vaccine. I don't care how good you are, but you will have vaccine leaking out, more risk of broken needles, and it's not near as time efficient. I have bet guys, and I've won every time, that I can work them faster through a chute than they can vaccinate them in an alley. and then I know I have better vaccines given. So, ideally, if you've got a lot of cattle you work, it is worth the investment to have a good chute to vaccinate your cattle. And, with the VBP Plus program, there used to be funding for $5,000 that you could use towards getting a chute. Not sure if that still exists, but good facilities are good not only for cattle safety and good vaccination, but also good for human safety, because it's harder and harder to get people sometimes to help us. So most vaccines are either going to go in the muscle, IM, under the skin, sub-Q, or up the nose, intranasal. And it's important to read the vaccine label and follow the directions for the route of injection, because otherwise the vaccine's not going to work as anticipated. If the label says you can give it in the muscle or under the skin, it's your choice. Tend to recommend under the skin to get less injection site lesions in tough beef. And we'll go through now some vaccination techniques. So with sub-Q techniques, there are two different methods. A two-handed technique, as in the video here, where they're pulling up the skin with their fingers and putting the needle between the skin folds, or a one-handed technique. My preferred method is the two-handed method, because then you can make sure you're under the skin and not going in the muscle. Yeah, it's important when you are putting that needle in that you actually inject the entire dose and don't have leak back from there. So here's a picture of this, again, pulling the skin up using a shorter needle. You should use a shorter needle for sub-Q technique. And here's another picture of that. Here's a video in a chute doing it, pulling the skin up. And here it's easier with the small neck bars there to go from a vertical angle. Here on the ranch, they're doing it again. She's picking up the skin and she's going to put the needle between the skin folds. And on a ranch, when you're giving multiple products, it's really good. It's a good job for the kids. Give them a different colored crayon for each different vaccine, so you can make sure that every calf gets every vaccine that you intended to give it. Here's a picture of the one-handed technique. Here we're going to use a short needle going at an angle, just like in this picture. And then here's a video doing it in the chute. We're just going to use that going at an angle, lift up the skin, and then inject the vaccine. This is in a calf table that we flipped over. One thing I don't like about this calf table, it doesn't have some head bars to restrain that head. But here she's going under the skin. I would say that's a little bit too close to give both products. You want to have a couple inches apart to give both your products so they don't interfere with each other. Thinner muscular vaccines, we want to go straight in at a perpendicular angle with at least a 1-inch needle. So as you can see here in the video, they're going to vaccinate between the head bars, going straight in with that needle and giving the dose of the vaccine. Important to check that you don't have leak backs, because you can have quite a bit of pressure pulling on that neck with the head bars. And sometimes then the skin is really tight, and if you're not careful, you'll get leak back. And then the vaccine, again, only half the dose or less is given. Thinner nasal vaccines, they still haven't come up with anything better than these plastic intranasal cannulas. And they sometimes fall off, so make sure you have it good on the syringe. Important to read the manufacturer's label directions. Some will tell you 1 ml per nostril, others will say 2 mL in a single nostril. Some will say you can do it either way. But the big thing is to get it in the nose and that the calf doesn't snot it all back on top of you, because it's not going to work. You might get a good immune response to it, but these viruses, bacteria, are not going to help you any. We want the calf to have that dose up its nose. They do recommend, the drug companies, you change the cannulas every 10 animals. They say if you have known disease in the herd when you're vaccinating, that you should change the cannula every time. But normally what I would recommend, if the cattle are sick, you shouldn't be vaccinating, because sick cattle are not going to respond to the vaccines very well. The only exception to this would be if we had an IBR outbreak, then we might be actually recommending that you vaccinate with an intranasal IBR to reduce the risk of the outbreak or the extent of the outbreak. But normally otherwise, you really want to try to vaccinate healthy cattle to get a good immune response. So here's a picture of an intranasal, or a video of an intranasal. We've got her in the calf cradle there, flip. Here's on the ranch. Again, important that you get that cannula up the nose and that it gets the full dose, and hopefully it's not snotting it back out. With usually we're giving more than one vaccine at a time. So again, important here to give a couple finger widths away from different vaccines so the products don't interfere with each other. So now you'll see a second other vaccine given, a clostridial, and she's giving it a few inches apart under the skin there. So again, we don't want product interference. You should never vaccinate through a product or give an antimicrobial through another product, because you will get interference, which is not good. Vaccine needle lengths and widths that we recommend. If they're under 6 months of age, we recommend an 18 gauge. If You're going to go under the skin, a short needle, 1/2 inch to 3/4. In the muscle, 1 inch. You don't want to use a 1.5 in a calf. That's way too long. You'll hit bone. With older cattle, over 6 months, I'd go with a 16 gauge. And typically, again, the same length, whether it's sub-Q, you want a shorter needle to go under skin, and you can use a longer. I personally don't like 1.5 inch. They tend to bend more likely, and then you have a risk of potential broken needle, which we don't like. We do not recommend 14 gauge inch needles. Those are very thick bore ones. Most of your vaccine leaks out, so they are not recommended. With your vaccination needles, we do recommend you change them every 10 to 15 head at least. Sometimes, if you happen to be implanting, an easy way to remember is when you change your implant cartridge, most of them are for 10 head, then you change your vaccination needles. Otherwise, if you have a 50 cc syringe, you're using IBR BVD, one syringe will hold 25 doses because they're 2 ml vaccines. So then as a minimum, every time you fill that syringe, put a new needle on, and then that makes sure you also put a new needle in the vaccine bottle, because you don't want to put dirty needles inside a vaccine bottle and contaminate that vaccine bottle. There are multiple different kinds of syringes for vaccinating available. This is the 50 cc repeater syringe. You can get one like this Alflex one with different handle colors, or you can get the metal one, the Rouleau syringe. This is a drop syringe. It comes in different sizes. We tend to use this for Clostridial vaccines or possibly for your one-shot or pre-spons. This is a bottle top syringe. We do not recommend these for vaccines because they're not as accurate at dosing. So when using a repeater syringe, obviously, you would have had the plunger all the way to the top, and now Bill is trying to fill his vaccine handle with the Clostridial here. It's important that you get your air bubbles out, point the needle up to the sky and carefully push so you don't empty half that syringe. But get the air bubbles out. Usually if you flick your finger against the barrel, the air bubbles will go to the top and you can get those air bubbles out. Because most of these vaccines are small dose, most are 2 ml doses. So we don't want a bunch of bubbles in the syringe because then we won't give them the proper dose to the cattle. Here, the Clostridial, she's got it hanging off her shoulder. Again, we tend to use a draw syringe with those. Just make sure that you have the proper size draw syringe and set up the proper dose for the vaccine you're using. Tasvax is a 4 ml dose. All the other Clostridials are a 2 ml dose. Again, just double check your vaccine labels to make sure you have the right dose. And when it's really cold outside, these draw syringes tend not to work because the vaccine freezes in the hose. And then you typically have to go to your 50 cc repeater syringes instead. Again, this is the bottle top, but we do not recommend it for vaccinations. It's just not as accurate. When you're using a syringe, really important to check the vaccine dose and then check where you're going to set the dose. And even when you're vaccinating, once in a while, just to double check that that dial hasn't rolled on you, because you don't want to underdose the vaccine. You're not going to get a good immune response. You don't want to overdose it because that's just a waste of money. Vaccines aren't cheap, so we don't want to spend more money than we need to. After you've used your vaccines, we need to dispose of, the empty containers. If you have a modified live vaccine bottle, half of it's left. Unfortunately, that needs to go in the garbage after 1 to 2 hours. Your Clostridials as well, they're supposed to go in the garbage. Your one-shot Manhemias, they're supposed to go in the garbage. Obviously, if you froze it, you're doing it in the winter when it's cold, the vaccine freezes. Don't put it under the heater. If you're inside a barn, you have overhead heaters, don't heat it and thaw it out, or take it into the kitchen and thaw it out and think you can use it again. It's no good. It's got to go in the garbage. If your fridge goes on the fritz, call your vet. But generally, if that fridge went on the fritz, you may want to do an inventory. You might have insurance to deal with that and get some money back for those vaccines, but they're generally not good after they hit 10 Celsius for any length of time. If you got little floaties in the vaccine bottle, that means it's contaminated. I would not use it because you don't know what kind of response. You might get injection site abscesses from it. And it's always important to check your expiry dates on your vaccine to make sure it's not expired. I would not recommend using expired vaccines, and the drug companies won't stand behind them. So, when you're picking up your vaccines, it's always important to put your newer vaccine with a better expiry date, hopefully it's a better expiry date, behind into the fridge on the shelf behind the older stuff if you have some left. So you use your older stuff up first before you start going into your newer stuff. We want to clean our syringes at the end of the day. I have been at ranches where they vaccinated and then they threw the dirty syringes behind the pickup seat. And then a year later, we got to vaccinate again. And then, where did we put our syringes? And then the dirty ones are sitting behind the pickup seat. So you can imagine that's going to be really hard to clean that syringe. So we do want to clean them, at the end of the day. Usually we have a party after spring branding, after, but they should be cleaned that day because it's much easier to clean them to avoid contamination being stuck on there. Obviously your needles, which are your sharps, should go in a sharps container. You can buy these more expensive sharp containers from your vet, or you can do it the Dutch way and just have an old Javex bottle, put sharp on it with a felty, and throw your sharps in the Javex bottle, and then when it's full, close it. Check with your vet or your local dump where you can dispose of them. They are biomedical waste, so those of us that have incinerators on farm, well, we generally just throw them in the incinerator. Just remember when you clean up that incinerator, sometimes all those needles don't melt. If you throw it in the field, you might get a few flat tires. So I did that once and got crap from my dad. So just beware of that. They don't always melt. When we're going to clean them at the end of the day with their 50 cc syringes, we should take them apart to clean them. They all have those little rubber rings in here. It's important, sometimes those will get dry and brittle like any kind of piece of rubber. You can buy bottles of these, or you can buy, little bags of these O-rings from your vet. They're quite cheap. And so we never want to put something in the barrel because, when you put this back together, sometimes it's really hard to move that plunger. And so then people used to, in the old days, put Vaseline in here or some kind of mineral oil. That can actually destroy the vaccines you're going to subsequently use in the vaccine syringe. So I would just dispose of that little old rubber ring and put a new one on, and then you should be good to go after that syringe is cleaned. So in this video here, he's going to show how to clean a syringe. We only want hot, potable water inside the barrel and cleaning inside of syringes. You do not want to use soap inside the barrel of any syringe because no matter how much you rinse that, you're going to leave some residue that can destroy the vaccine the next time you use that syringe. You do not want to use rubbing alcohol to clean syringes either because that alcohol will leave residue that will kill particularly modified live viral vaccines. So no disinfectant inside the barrel of the syringe. Your 50 cc repeaters like this should be taken apart to clean properly. And then you can let them air dry in a dust-free location and then put them together again. Your metal Rouleau syringes, you can actually, I've had guys put them in a pressure cooker when they didn't have good potable water, or my mom used to put a pot on the stove with boiling water and she'd boil the syringes. So it doesn't work so good with those plastic Alflex ones, but your Rouleau are those metal ones. You can actually do that. Just remember that rubber ring. You don't want to put that in boiling water, you're going to destroy it. Like we said, hot water is the best way to clean syringes. If you have a lot of manure or dried up dirt on the outside of the barrel, you can scrub that off with a little soap and water and rinse it. Just make sure the soap doesn't go into the barrel. Here we have a draw syringe. You can see he's got a sink full of clean hot water, and then he's going to squirt the dirty stuff in a pail. Don't squirt it back into the water here because then you just contaminate the water. Obviously, you have nice 2 sinks, then you can have 1 sink full of hot, clean water and then squirt it into the empty sink. You want to keep squirting clean hot water through this barrel till it comes out clean. If you happen to use a bottle top, most of them you can take apart and clean them in hot water, and then after they've dried, you can put them back together. But again, we typically don't recommend bottle top vaccine guns for guns for syringes for using vaccines. It's one thing to use it for other drugs, but not recommended typically for vaccines. Storage, this is what vaccine companies or drug companies recommend, that we put them in a nice clean Ziploc bag, or you can use a Tupperware container. They do suggest putting them in a fridge so you don't get mold. Often we don't have enough fridge space to do those things. So you can also put them at room temperature, but it should be either in a clean Ziploc bag so they stay dust free, or if you have a clean Tupperware container, you can also put them back in a clean Tupperware container with a lid on to keep them clean till the next time you use them. So I would like to end by acknowledging all these people. We had funding from the Beef Cattle Research Council, as well as Alberta Cattle Feeders, Manitoba beef producers, and as well as all these pharmaceutical companies, which are all the major suppliers of bovine or beef cattle vaccines. Then all these other individuals, participated in the development of a bunch of training videos. We are going to have training videos on vaccine handling up on the BCRC website shortly. That will be different. They'll have some of the stuff in this presentation, but we'll have additional stuff. We are also creating other extension tools that we did a survey of producers which they wanted. So we will be developing some fact sheets on the core diseases that we're recommending vaccination for, as well as we will develop a herd questionnaire that your veterinarian could provide you to keep them updated on some of your herd stuff, to help them in discussions with you to develop a vaccination protocol specific to your herd. And then we'll also do some webinars, podcasts, as well as create some written articles, for example, in Canadian Cattleman Magazine. And for vets, we will also do that through the Western Canadian Association of Bovine Practitioners. And so we hope to have all those materials available. The handling with vaccines will be available probably within the next month. And the other extension tools will become available over the next half year. So hopefully those tools will help you. We're also going to create some decision trees. I mean, the core vaccines, we do recommend that for all beef herds, but the risk-based ones, we will try to create some decision trees to help you and your veterinarian decide whether those vaccines are of value in your beef herd. So in closing, I'd like to thank all these individuals. Saskatchewan Cattlemen's was heavily involved with this, as well as Saskatchewan Agriculture. And so thank you all. And the University of Saskatchewan was also involved. So I want to thank everybody in Saskatchewan as well very much for participating in the development of all these training materials that will soon all be available for you on the BCRC website. Thank you.
All right, thank you, Joyce.
You're welcome.
We are now ready to take questions at this time. If you have not already done so, you may type your questions in the question box in the bottom right-hand side of the control panel. If we don't get any questions during this time, we'll ask our presenter to answer them in the chat or follow up via email. So we do have a few questions here. So our first question is, you mentioned not giving too many vaccines at once to avoid an overload. Is there a rule of thumb for the max that can be given at once?
No, there's not enough research to tell us, you know, should we give only 2 antigens? Can we give 5 at a time? Like over the years, you've all seen pharmaceutical companies try to make it easier for you to put more antigens in a single shot, so you don't have to give so many needles. But it's always important to ask, well, do you really need that antigen? So for the core vaccines, we're saying, yes, you should vaccinate against those. So for example, your IBR, BVD, you know, PI3 tends to come along with it, VRSV. You know, but do all different groups of cattle within your herd actually need all those antigens every time you vaccinate them? So that's something you need to discuss with your vet. So, you know, I always was very particular against which antigens I used in which group of cattle. And it's also based on the timing, what you're trying to prevent. Are you trying to prevent reproductive disease, like abortions or dummy calves, or you're trying to deal with respiratory disease? You know, and when are you going to give these? So you need to, you know, work with your veterinarian to really fine tune these vaccination protocols. And more is not better in this case when it comes to vaccines. So there's no magic number that says only give 2 at once, or maximum you can give is 4. There's not enough research to tell us that, but we do know, you know, if you give too many at once, and particularly, you know, we tend to stress these cattle with handling. You know, we should always use low stress cattle handling, but there's probably, from the CAS perspective, no such thing as low stress cattle handling because we're stressing them, because we're putting them through a chute or catching them. You know, we have to realize when we stress these cattle, they're not going to respond as well to vaccination just from the fact we've stressed them. We're stressing their immune system. So fine tune your programs based on what your disease risks and try to work with that.
All right, thank you, Joyce. The next question, if calves aren't 3 months old at branding, will vaccines work or will the response just be reduced?
Well, depending again which antigen you're given. So if the calf has immunity from its mom, colostrum immunity, to that particular virus or bacteria, when it's say only 3 weeks old and you vaccinate them, again, it depends what vaccine you use. So that's why there's been a big push on these intranasal vaccines, because we can generate interferon, and we have local mucosal immunity, which we tend to see the research suggests less interference with any colostral immunity from their mom that they may still have present at 3 weeks of age. That's assuming they got adequate colostrum and actually have some of those what we call passive antibodies. So I have done work at Vito, you know, in young calves as early as 3 weeks of age, and vaccinating. In those days, we had the Sonostar PH vaccine, which is a great vaccine. And even though there was maternal antibody there, we did prime the immune response. So, you know, you'll read the vaccine labels that says if you, depending on the product, if you use it at this young age, make sure you booster them. So with any vaccine, you know, if there is colostral immunity interference, you definitely want to boost that calf, you know, a minimum, I would say, of 2 months later, depending on when you can handle them, right? To boost that immune response. But typically, we will see some priming. But that's why the big push for intranasals now, to try to overcome some of that maternal antibody interference.
Okay, thank you. The next question is, will antibiotics given at the time of vaccination have any effect on the vaccine?
No. So, especially, if we have sick cattle or if you're castrating, you might give a shot of penicillin if you're worried. No, they don't, because our viruses don't respond to antimicrobials, so you will have no impact. So the only problem you'd have to look at is if you have a bacterial vaccine where the bacteria is alive. So there's not too many vaccines on the market that I'm aware of that have a live bacteria or an attenuated bacteria. And personally, I would not recommend using any of those based on my experience. So, your one shot, like your manhemioleucotoxins, they're just a leukotoxin, so that's not going to be affected by an antibiotic or antimicrobial given at the same time. Your Staphylococcus vaccines are all killed, so you can't kill it anymore, it's already dead. But just make sure that there isn't a live or attenuated bacteria within the vaccine. That would be the only one that might have a negative effect with an antimicrobial, but personally, I would never recommend using those.
Okay, thank you. And then our last question is, how important is it to keep the syringe cool once it is loaded with a mixed vaccine? Should it go in the cooler between animals?
Well, I would say not very practical, unless it takes you 5 minutes to catch the next one. So, some guys will fill, for example, 2 50cc syringes. You have a 100 ml bottle of IBR BVD. Instead of putting half a bottle back, they're just going to fill 2 50cc syringes. So then, and you're only going to use 1 syringe, then I would put that syringe back in the cooler box, make sure it's not directly on the ice pack, and then close the lid. But in between vaccinating individual animals, unless you're sitting there for a really long time in the sun, something's happened, your chute's broken. If your chute's broken for a while, or you have some chaos, a calf is flipped upside down in the alley, and you're going to be busy trying to unflip it or get all the other calves off it that jumped on top of it, then I would put your syringe back in your cooler box with the lid closed. But normally, no, in between doing every individual animal, usually it's fast enough that shouldn't be a problem.
Okay, thank you, Joyce. This concludes the questions for today's webinar. So at this time, I'd like to thank everyone for joining us for session 3 of our fall webinar series. And a special thanks to Dr. Joyce Van Donkersgoed for putting together her presentation. There will be one more session on October 18th, so be sure to tune in. In addition, a bonus session on ergot and mycotoxins will be recorded and available to all participants in the coming weeks. If anyone has any further questions regarding this topic or other agriculture-related issues or inquiries, please contact your nearest Saskatchewan Agriculture Regional Office or call the Agriculture Knowledge Center at 1-866-457-2377, or you can visit our website at saskatchewan.ca/agriculture. Thank you again for joining us today and have a great afternoon.